Now I'd like to just suggest that you might want to take advantage of some of the outside resources in the course. And we scroll down here. Of course, there are a variety of resources. I would suggest that you might want to try the practice quiz games, and particularly this link that is here, the blue histology. If you got multiple choice quizzes you can drill yourself with, you can actually choose multiple tissues or organs and then start a quiz, and you'll be able to see the answer when you enter the answer. Also, a single answer quiz. For example, if we go lymphoid organs and tissues and start, then name the blood vessels that were used by circulating lymphocytes to enter the lymphoid tissues. And so these would be the high endothelial. And if you hit enter, well, you see, they want me to add venials, and that's true. But this is helpful because you may put in part of the answer, but then you hit enter, and it will give you feedback. So I just suggest you might want to try that. So next I'm going to pull up some virtual slide specimens just at random, and I will just spend a few minutes reasoning through the slides. Maybe this will help you in making decisions on the final exam. Okay. Okay, here's a specimen, and suppose we circle this specimen and said identify the organ. Or we could ask you to identify the epithelial tissue that lines the lumen of this organ. And in order to answer that, I mean, you can make a guess. To me, it looks like either the ureter or the vas deferens. That's what would be my first guesses, because I see all this eosinophilic material out here, and I'm pretty sure that that is in smooth muscle cells. And if I increase the magnification, I can clearly see that those are smooth muscle cells. And I see them cut in cross-section here, and longitudinal profile here, and a cross-section here. And so there are 3 layers of smooth muscle cells, and I know that that's present at some point in the ureter as well as the vas deferens. But then I need to look at the lumen. Now, if it's going to be the ureter, it's going to have to be transitional epithelium. But I see that this is actually not. These are columnar cells. And let me just pause this a minute, and I'll comment on that. So you can certainly see that the epithelium is not composed of multiple layers, like 3 or 4 or 5 or 6. And you can see that the surface cells are not dome-shaped. And so that rules out transitional epithelium, and therefore it can't be the ureter, urinary bladder, or the pelvic region of the kidney. Of course, the pattern of the whole thing wouldn't fit into the kidney. But it is epithelium that is pseudostratified. It's a mixed up epithelium, and it has a basal layer here and then a more superficial layer. But you can see the cells and nuclei here are kind of mixed up. So those criteria are important and differentiating this structure from others that might be similar to it. Okay, here's another specimen that we might present to you. We could ask any part of this. We could maybe define this area here and ask you to identify it. Would be the mucosa of some sort, but the mucosa of what? And so remember, in your hollow organs, be they the cardiovascular organs or the GI tract organs, or even the respiratory tract organs, and the urinary tract and reproductive tract, it's really the epithelium that lines the lumen that gives you the biggest clue. And so if we look at the lumen here and we see these cells that are all fairly lightly stained, and these would be goblet cells, and the entire mucosa is composed, it seems, of goblet cells. And that should remind you of the colon. And then you look on the very surface and you will see some cells that are not goblet cells, and these are the absorptive cells. And of course the rest of the tissue would be the submucosa and the muscle layers. In fact, there's a Taenia coli, that's the thickened band, longitudinal band of smooth muscle that's running up and down the colon. And the inner layer, of course, is circular, and that's what this is here. And here could be another specimen. And we're looking at this and identify these structures. Hopefully you recognize these as villi. So this puts it in the small intestine. It could be either duodenum or it could be the jejunum or ileum. We don't ask you to differentiate between the ileum and jejunum, but we do ask you to differentiate between the small intestine, large intestine, and the duodenum. So this is definitely small intestine, but is it the duodenum? So you have to look in the submucosa to see if there are glands. So zooming in and out and looking at the whole specimen, regardless of what we point out, should be helpful in making your final decision. Okay, this could be a question where an X is placed in the lumen. You're asked to identify this structure in which it has the letter X in the lumen. Well, the first thing you need to do is at higher magnification, you can look around and see what's here, and immediately this reminds me of the pattern of the testes of a semi-niferous tubule. And if I move this at lower magnification, I can see where this context is. And then I zoom back in, and I see that this is a connecting structure between a semi-niferous tubule and perhaps the reedy testes. This could be a straight tubule. So you need to review things like that and zoom in and zoom out before you make a conclusion. I just have the hunch that a lot of times when you're in the test, some of you will just look at this and say, oh my gosh, what is that? But if you back up and you go at higher magnification and you think about what it could be and look for the clues, it should be helpful. Here's another structure. And a part of this organ is defined, and a question could be asked about this. Well, what is this? And you have to look around and think, okay, this must be the lumen up here, and I see this structure. Let's take a look and see. Okay, I see irregular spaces lined with epithelium. Reminds me of either the intestine, but there are no villi, and I don't see goblet cells, so I'm going to rule out intestine, large or small. And I'm thinking uterus, and I go out here and I look and see, oh, look at the enormous amount of smooth muscle cells. And we know that the myometrium of the uterus is populated by the enormous amount of smooth muscle cells. So if this is the uterus, which it is, then this is the endometrium, and this is a proliferative phase of the endometrium, which most of the glands are rather straight, but you're beginning to see some pileup here because these cells are dividing under the influence of estrogen. Okay, so here's another type of question. We could say, okay, identify this, and that's enclosed within the dotted line. And you might take a guess immediately and be correct. You might think, oh, this is salivary gland. Well, if it's a salivary gland, do I see consistent acini? Well, out here, if I enlarge this area, I see acinar cells grouped around in a form called acinus. Then I see red secretory granules. I see basophily at the base of the cell, which represents the presence of roughy R. But this area is entirely different. So I'm going to zoom out. Now I see more of them. I see one here and one here. I see some adipose tissue, some fat cells out here, the white fat cells. And so well, what this is the pancreas, and that's the islet. We could ask you to identify the organ based upon what you see here. We could ask you to name a product that's secreted within this part of the pancreas, the islets. We could also ask you some structure out here, say this cell here, a central acinar cell. So just to remind you, if you think about each of the organs, think about all their parts, think about the unique features and what's present, think about the association of the cells with the function. Okay, one last example. This could be tough because it's not stained very well, but if we ask you to identify the organ, you look at it, and you see the very smooth surface here. This must be the surface, and then the rest of them, if you look at them, they're probably cut surfaces. You see some open spaces that might remind you of blood vessels. But how are you going to identify this organ? Well, you can see a slightly difference in the staining here compared to over here. So this is a little more eosinophilic and less over here. So that's suggesting it may have a medulla and a cortex and a medulla. Then you can think, well, which organs have the cortex and medulla? And that reminds me, if you go to the lecture on the organization of organs, or you go to the WebMike study guide to the unit there on differential diagnosis of organs, very helpful algorithms there. So I'm thinking of the organs that might have the cortex and medulla. Well, you've got the thymus, you have the lymph node, you have, what else? The kidney, those are three. And a couple more would be, say, the ovary and the adrenal gland. So it's got to be some of those. So what are the features I'm going to look for? Well, I'm going to look for lymphatic nodules in the cortex, which would suggest it's a lymph node. I'm looking at a continuous dark blue staining in the cortex with a light medulla and the patterns that represent the lobules, and that could be the thymus. The ovary, I'm going to look for oocytes in the and follicles in the cortex. Adrenal gland, I'm going to look for a pattern of long, tall strings of cells. But let's just look at the cortex here and zoom in. And immediately we recognize a very distinct feature that says it's kidney, the glomerulus. So those are the kind of things that hopefully should be helpful as you approach the final exam.